Welcome to Smart Wellness Tips, where we uncover the silent signals your body sends before a major health crisis occurs today. Your hands are more than just tools. They are complex biological maps revealing the hidden state of your cardiovascular system health. We call these subtle indicators vascular whispers, which are early warning signs that appear long before a heart attack or stroke. Most people ignore these small changes, thinking they are just signs of aging or fatigue, but they tell a deeper story. By learning to decode these whispers, you can take proactive steps to protect your heart and brain from sudden, dangerous events. Why do we focus on the hands? Because they are the furthest point from your heart in the entire circulatory system. Your hands rely on the same network of arteries that feed your brain, making them a mirror of your cerebral health. When blood flow begins to weaken, the tiny capillaries in your fingertips are the very first places to feel the impact. These extremities are extremely sensitive to changes in pressure and oxygen levels, acting as a biological alarm system for your body. We will examine three main groups of signs you must observe: color changes, strange sensations, and sudden loss of physical strength. Let us begin with the first and most visible sign, which is the changing color of the skin on your hands. Healthy hands should have a consistent pinkish hue, indicating that oxygen-rich blood is reaching every single cell in your tissues. If you notice your skin turning pale or developing a bluish tint, it indicates a significant drop in oxygen saturation levels. Mottled red patches or uneven skin tone can also signal that your blood vessels are struggling to regulate flow properly today. Pay close attention to asymmetry. If one hand is significantly paler than the other, it is a serious red flag warning. This difference often suggests a blockage or narrowing in the arteries, specifically on that side of your upper body system. Do not ignore these color shifts, especially if they occur when you are resting and not exposed to cold temperatures outside. Medical professionals often look for these specific discoloration patterns as a primary clue to diagnose peripheral artery disease in patients. In severe cases, the fingers may turn completely white, a phenomenon that requires immediate medical consultation to prevent tissue damage. While cold weather causes temporary changes, persistent discoloration in a warm room is a vascular whisper you must never ignore. Now we move to the second critical sign, which involves the strange sensations you might feel in your hands and fingers. Nerves need a constant supply of oxygenated blood to function. Without it, they begin to malfunction and send error signals. You might experience numbness, tingling, or a sensation often described as pins and needles, appearing without any clear external cause. This is not just about your arm falling asleep. It is a sign of temporary oxygen deprivation to your nerves. These prickling sensations can occur suddenly while you are watching television or sitting quietly, unrelated to any physical injury or trauma. If you frequently feel this tingling while performing daily tasks, it suggests your circulation is struggling to support nerve function. Vascular issues often mimic nerve compression, but the root cause is the lack of blood flow, not just physical pressure. Waking up with numb hands frequently is another whisper that your cardiovascular system is under stress while you are sleeping. Think of these sensations as a distress signal from your nerves, begging for better circulation and more oxygen immediately today. Ignoring these sensory warnings can lead to permanent nerve damage over time. So please, listen to what your hands say. The third major sign is a sudden or gradual decline in the physical strength of your grip and hand muscles. Grip strength is a powerful biomarker that correlates directly with your overall heart health and risk of future cardiovascular events. If you find yourself frequently dropping small objects, like keys or pens, it is not just clumsiness, it is weakness. Muscles require a robust blood supply to maintain contraction force. Without it, they become fatigued and weak, very quickly indeed. Doctors use grip strength tests to assess biological age and predict the likelihood of heart attacks in older adults globally. A sudden drop in your ability to hold on to things suggests that your vascular system cannot meet the muscle's demands. This weakness may also manifest as difficulty in handwriting or performing fine motor tasks that used to be easy for you. When arteries are narrowed, your muscles are essentially starving, leading to this noticeable reduction in power and functional capacity daily. Test your grip daily. If you feel a consistent decline, it is time to investigate the health of your arteries. Now that we know the signs, Let us learn two simple self-tests you can perform at home to check circulation. The first method is called the capillary refill test, a standard clinical technique used to assess peripheral blood flow efficiency. Start by pressing firmly on the nail of your index finger until the skin underneath turns completely white and pale. Hold this pressure for about 5 seconds to force the blood out of the tiny capillaries in your nail bed. Release the pressure instantly and observe how many seconds it takes for the pink color to fully return to normal. In a healthy circulatory system, the color should return in less than 2 seconds, showing rapid and efficient blood refill. If the color takes longer than 2 seconds to return, it suggests sluggish circulation that requires your immediate attention and care. This delay is a strong indicator of dehydration, shock, or peripheral vascular disease that is restricting flow to extremities. Repeat this test on different fingers to ensure the result is consistent across your hand and not just a fluke. While age can slightly slow this process, a significant delay is never normal and should always be discussed with doctors. Ensure your hands are not cold from the environment before testing, as external cold can give you a false positive. The second self-test focuses on temperature symmetry, which is a critical way to detect one-sided arterial blockages in the body. Simply place the back of your hands against your cheeks or against each other to sense any difference in warmth. If one hand feels significantly colder than the other, especially the left hand, it could indicate a specific arterial issue. A cold left hand is sometimes linked to narrowing of the arteries that branch off near the heart and neck. You can also check your pulse at the wrist. A weaker pulse on the cold side confirms reduced blood volume. This asymmetry is a major warning sign for potential stroke risk and should prompt an immediate visit to a cardiologist. Keep a journal of these temperature differences, noting when they happen and if they are accompanied by any other symptoms. If warming your hands externally does not equalize the temperature, the problem is likely internal and structural, not environmental. Early detection of this asymmetry allows doctors to intervene with medications or procedures before a complete blockage occurs in arteries. Mastering these two simple checks empowers you to monitor your vascular health daily without needing expensive equipment or doctor visits. Now, let us discuss practical solutions to restore healthy circulation and silence these vascular whispers before they become loud screams. The first and most immediate solution is thermal therapy. Soaking your hands in warm water helps dilate constricted blood vessels. Warmth acts as a natural vasodilator, instantly reducing resistance and allowing fresh, oxygenated blood to flood back into your tissues. Combine heat with movement. Perform rhythmic hand exercises, like clenching and rotating your wrists, to pump blood back to the heart. These movements activate the muscle pump mechanism, which is essential for overcoming gravity and keeping your circulation flowing strong. Hydration is non-negotiable. Thick, viscous blood moves slowly, so drink plenty of water to keep your blood thin and flowing. Diet plays a huge role. Incorporate foods rich in omega-3 fatty acids, along with ginger and turmeric, to reduce inflammation. Ginger and turmeric are powerful natural blood thinners that prevent clots and improve the elasticity of your arterial walls significantly. Do not forget systemic exercise. Walking for just 30 minutes a day improves circulation not just in legs, but everywhere. Regular hand massage stimulates blood flow mechanically and reduces stress, which is a known constrictor of blood vessels in humans. By combining heat, movement, hydration, and nutrition, you create a powerful defense strategy for your cardiovascular system's long-term health. Your hands are faithful messengers. Treat them well, and they will tell you the truth about your body's condition. If you found these tips helpful, please share this video with loved ones who might be ignoring these silent signs. Do not wait for a crisis to strike. Take a moment right now to look at your hands and listen. Thank you for watching Smart Wellness Tips. Subscribe for more life-saving insights, and take care of your precious heart health daily.